During a stroke, the brain loses 1.9 million neurons per minute. If AI is going to help, it has to live exactly where minutes are lost. And that's why, before we can effectively use AI in a hospital, we need to understand exactly where it fits. Hi, I'm Nish Afsar, UK Clinical Affairs Lead at Newton's Tree. And in this video, I'll be showing you how to map an AI-enabled clinical pathway. We'll be using a swim lane diagram that shows where AI fits in from start to finish as the patient moves through the care process. The first step is to identify the AI technologies you're using and clearly define their intended use and purpose. If you're working with a simple pathway, this might just be one application, but more complex pathways can have multiple AI technologies supporting different stages of care. Next, define the patient population. This is the group of patients your AI will affect. You'll add them as the next swim lane in your diagram, so we can see exactly who the pathway is built for. Then, map out the other stakeholders in the pathway. Depending on your scope, this could include healthcare professionals in primary, secondary, and even tertiary care. It might span across general medicine, diagnostics, therapy, and more. Now you're ready to draw the journey across the swim lanes, starting from the patient's initial presentation, moving through each setting of care, and marking where AI comes into play. For example, a patient might present to primary care for initial assessment. The primary care physician uses an AI application for risk assessment, which informs a triage decision. The patient is referred to secondary care with an appropriate flag. There, the clinician orders imaging and uses AI as a second read in radiology to confirm the diagnosis. That result goes back to the primary care physician, who decides whether the patient needs treatment or can be discharged. Once your pathway is mapped, you can start to analyse the intended impact of adding AI and compare it with evidence from similar AI deployments. This helps you gauge both the likelihood of success and the potential to achieve your desired outcomes. And that's how you map an AI clinical pathway using a swim lane diagram. It's a simple but powerful tool to see exactly how AI integrates into patient care and to plan for meaningful, measurable results. If this video helped, please like, share, subscribe, and leave a comment. And if you're planning to deploy AI in your hospital, Newton's Tree works with hospitals to build safe, effective, and sustainable AI deployments. Thanks for watching, and we'll see you in the next one.